This segment is brought to you by Trinidad and Tobago IVF and Fertility Center. World-class specialists, capabilities and care. Fertility, step by step. Your journey to parenthood.
6 minutes after 7 o'clock in Trinidad and Tobago. Yes, here we are again to talk about fertility step by step with Dr. Catherine Minto-Bain, Medical Director and Fertility Doctor at the Trinidad and Tobago IVF and Fertility Center. Dr. Minto-Bain and her team in Trinidad and Tobago offer the full range of fertility solutions for couples having difficulty conceiving a baby. Over the next few months, we're going to be looking closely at male infertility, which is a significant issue in Trinidad and Tobago, all about egos and all of that, but we're going to deal with the facts and the science and the data in relation to male infertility. Today, we're going to start with a conversation about male fertility myths. So, gentlemen, it's time for us to listen up, basically. We are also inviting your calls, 623-1711, extension 1995, if you have any questions about male fertility or infertility. And indeed, during the course of our discussion, we'll pause the discussion if we get any of those calls coming in. 623-1711, extension 1995. So, Dr. Minto-Bain, very good morning to you. Thanks very much for joining us for what should make for a very interesting but hopefully informative dialogue. So let's get started.
Hi, Fazeer, morning. It's so nice to be here. Yeah, so the first myth I'm going to talk about today actually is a really dangerous myth, and it's a huge problem in TNT. It's this idea that a man should take testosterone to treat his infertility. And, you know, guys, let me state this really clearly. If you have low testosterone, taking testosterone medication is not actually going to improve your fertility. It actually does just the opposite. It makes things worse. So taking testosterone is actually a cause of male infertility. So taking any kind of testosterone or androgenic steroid kind of medication, tablets like Proviron, gels or injections, what it does is it stops your own testosterone. And when this happens, that's when sperm production in the testicles gets switched off and you simply stop making sperm. So think of it this way, guys. If you take testosterone, it's just the same as a woman taking the birth control pill. And we see this loads in the clinic, and it causes problems because it takes time for your body to recover. Taking testosterone will make you infertile for at least 3 to 6 months usually, but in some cases up to a whole year, 12 months. And this delay is, it's time sensitive. Fertility treatments are there to help you have your baby, but we want to get going. So if a doctor or a pharmacist or anyone else offers you testosterone to help with your sperm, really, really please say no to that one.
Well, you know, I actually know about that one, Doc. Not that I take testosterone for that reason, but in the days of the bad old days of the 1980s when sprinters were taking all sorts of things for performance enhancers, it was said one of the side effects of taking testosterone and all of those banned substances was the impact on the male genitals. So at least I know that bit of information. But as I said, it's something that people find uncomfortable to discuss. I don't know why, but it's all about science and fact and data, and we're happy that you're here with us this morning to talk about these things. So here's this one, and I didn't know this. The world's oldest father had a baby at 96 years of age. Can men have children at any age?
Yeah, so yeah, the oldest father in the world, he did have a baby at 96. You know, men and women, they're totally different. I mean, we know that. I mean, we all know how amazing women are. Women are born with all the eggs they'll ever have, and that's it. But men, they make sperm continuously, millions, far too many, millions and millions of fresh sperm every single day, over 1,000 sperm with every heartbeat that goes by. And yes, men, they can continue producing sperm right up until death. But, and this is important, but male fertility does begin to fall after the age of around 40 or so. And that's when we begin to see lower semen volumes, changes to the sperm swimming and movements, lower numbers of properly working sperm. So the numbers and the quality of sperm definitely decrease with age. And what does that mean? Well, it means that the older men not only have a reduced chance of pregnancy, but they actually also have a greater chance that you're going to father a child with a genetic or a chromosomal, or sometimes one of those developmental conditions. And that includes Down syndrome and autism. So, and I think people don't realize there's also a significantly greater risk with older men of miscarriage and fetal death.
Very important that we point that out as well. So yes, it is possible as late as 96, but there are always risks attached to that because of the decline brought on by age. But what about lifestyle? Because I suppose people feel that they could do what they want and it will have no impact on fertility.
And I wish that were true, but we know now that that's not. Fazeer, it takes 2 people to make a baby. So yes, the woman, she's got to embrace a healthy lifestyle, to have a good pregnancy, and to set that baby up for a good, healthy life in the future. A woman, what she does in pregnancy has a huge impact onto that child's life and its health, actually. But the same goes for men. A man's weight can affect sperm quality and quantity. If a guy's overweight or obese, you're at risk for illnesses that affect fertility, like diabetes. Plus, you're at risk for lower testosterone levels, higher estrogen levels, poor sperm production, all of which affect your fertility. If you drink heavily or use drugs, including weed, marijuana, you can drive your sperm count down and affect its quality, making it harder to conceive a baby. And smoking, that's just terrible for life in general, but for fertility. It reduces sperm count, it reduces motility, the ability of the sperm to swim, and morphology, which is the shape of the sperm. So men, guys, smokers have twice the risk of infertility compared to non-smokers.
And you still wonder why there is this idea that smoking is still fashionable and people can't resist it or whatever. But I mean, all the evidence, all the science is there, and it's not just in relation to fertility or infertility, but for so many other reasons, lung cancer being one of the prominent situations as well. Okay, so let's talk, if we get further, what about the idea that a man's ejaculate, if it looks normal, that his sperm is okay?
Yeah, so that's not true at all as well. The only way to analyze sperm is a sperm analysis, semen analysis by trained technicians. And sometimes even a standard sperm test isn't enough. In cases like that, sometimes the semen looks absolutely normal, then the sperm looks normal when we look at them. But then we use a more sophisticated test called a DNA fragmentation and we find the problem.
And as we're talking about debunking a number of different myths and so on, I think there was a reference to it, I think by the Prime Minister, talking about something in relation to a different issue, but horny goat weed. That generated a lot of discussion at that time. But is that good for fertility, or is that another myth?
Another myth. Those expensive supplements containing horny goat weed, which I think the marketer seized on as a name, but actually it's called barren wort. Barren is a good word here. Have never undergone scientific trials. Horny goat weed, it's just one of over 100 plants rumored to have beneficial effects on erectile dysfunction, but not infertility. So difficulty with sex and maintaining an erection. No studies have even looked at its effect on actually on erectile dysfunction or infertility. So, any claims about medical benefit really are pure just guesswork. What we do know, though, is there are some very unpleasant side effects of taking horny goat weed, including you get an increased risk of bleeding, vomiting, fainting and dizziness, upset stomach, you get more nosebleeds, more low blood pressure, and it comes with irregular heartbeats for some people. And if you use it in high doses or for an extended period, it's even been shown to cause severe breathing problems or respiratory failure, and that's been proven. So think again about horny goat weed. Yeah.
And we have our first caller on the line. Again, the number to call 623-1711, extension 1995. And what I'll ask you to do, caller, just if you would like to pose a particular question to Dr. Minto-Bain, you can do so directly. And once the doctor hears your question, she can respond without me intervening. If we have any issues about hearing you clearly, I'll try to assist. So please go right ahead. Good morning to you.
Good morning. Good morning, Dr. Minto-Bain.
Good morning.
Yes, go ahead. Hello?
Yes, hello?
Yes, go right ahead, please, with your question.
Right, thank you. Does the type the way you affect the sperm count?
So you were breaking up just a little bit. Just say it again, because we were losing you there a bit.
Right. The way.
Okay, you're breaking up. What I'll do, maybe I could ask my producer just to take the question from the caller and repeat it to us. Because for some reason the call is dropping off just a bit, but let's remind you of the number to call once more, 623-1711, extension 1995, and we'll see if we can actually relay the question via our producer to the caller. Okay, so that call apparently dropped off. So let's continue in the meantime, Doc, with our next question. And again, we're trying to debunk some myths here. Boxers or briefs? What's the impact on male fertility?
So there's no clear, definite link between boxers or briefs and infertility. But you know what? Scrotal temperature matters. Your testicles, they hang outside of the body because they need to stay about 2 or so degrees cooler than the core body temperature. And that's why they're outside the body instead of tucked away and nicely protected inside the body like a woman's ovaries, which would be more sensible because it's protected. So testicles, they need to be a little cooler. So really exposing your testicles to heat for a prolonged period probably can affect sperm production. So but people always ask, actually, hot countries, do they have more problems? It doesn't seem to be the heat in the country, but the heat around the actual testicles. So my advice is, yes, wear the looser fitting boxers, avoid the tighter trousers, the tighter briefs that pull the testicles close into the body and just might increase the heat a little bit. And it's not a myth to say that working with a laptop on your lap, which exposes your testicles to heat radiation for an extended period, could be bad for fertility. There's some studies showing that now, actually. So laptops, put them on a table, put them on something, but not on your lap for hours and hours.
Indeed. So maybe we should change the name from laptop to tabletop. That might help in that regard. I think we have a caller on the line now. Let's see if we can get that caller clearly. Good morning to you. Go ahead, please.
Yeah, morning, doctor. Morning, Fazeer.
Good morning to you.
Doc, my concern is about the preserving the sperm for artificial insemination. What is the lifespan that for preserving the male sperm? Does it get weaker? It's less effective as time goes on?
All right. Thank you very much for your question, Doc.
So yeah, once sperm is ejaculated, if you leave it out in the cold and it gets exposed to the weather, to the environmental conditions, it doesn't like it, and it degrades and it gets less and less good over a day or so of, or even quicker, of being able to make a baby. But if you ejaculate it into the woman's body, or you keep it in a nice warm incubator in the lab, which we have the same thing, actually sperm lives for days and days and days. So we know that a man's sperm inside a woman's body actually lives in the fallopian tubes waiting for an egg for at least 3 or 4 days, if not up to a week. So it's the conditions you keep the sperm in that preserves them. The quality of the sperm maybe drops off over time. Nobody really knows. But certainly sperm live inside a woman's body if you look after them well for quite a few days.
All right. So before we in fact, we do have another call on the line, as we try to get as many in before time runs out on us, because I still have to get through one more question with Dr. Minto-Bain. Good morning to you. Go ahead, please.
Good morning. I'm calling to find out. Yesterday I called to make an appointment for my son because of a fertility problem. And I was told that he cannot come by himself. He will not be able to get attended to. He has to have a partner. So I was not given the appointment for him. So I'm a bit concerned as to what the arrangement is.
Okay, well, I don't know if you're able to respond to that. I know it's not directly dealing with the topic this morning.
I can. That clearly wouldn't be our clinic, because the guy
okay.
can.
Yes,
so
okay.
that wouldn't be Trinidad.
Caller, if you could just you could hang up now and just listen to Dr. Minto-Bain to avoid the voices crossing one another. So go ahead, Dr. Minto-Bain.
Hi, good morning. I'm so sorry you had that problem. I can tell you for sure that would not be Trinidad and Tobago IVF and Fertility Center, so that's definitely not my clinic. Men are more than welcome to make an appointment on their own. You do not need a partner at all. We have young guys coming in for cancer treatment who come in to do sperm tests, all sorts of things. So I suspect you're talking to a standard lab that does basic sperm testing and probably doesn't understand your situation. So my advice is, if you give us a call in our clinic, 622-8869, but if you give us about half an hour or so, I'll talk to Maria and Rejan, who work there, and we can get you sorted out. So 622-8869, Maria, Rejan, they'll be there to help you in about half an hour, and I'm sure we can get that sorted for you, because absolutely he can do a sperm test and he does not need a partner. So we can help you.
So let's just deal with the last of our true and false questions for today. Is the only solution for male infertility getting a sperm donor?
So for men who've totally stopped at all making sperm, where it's irreversible, and we can't get the sperm in any way, yes, then sperm donation is the only option. But that's rare these days. Fazeer, there's several treatment options for infertility to help men become biological fathers, even when their sperm test shows no sperm in their ejaculate. So sometimes we can do a simple surgical intervention to correct a blockage, or we can do surgery to get sperm out of the testicle when it's not coming out when you ejaculate, and we can use those to make a baby, those sperm. And then for men with mild problems, we've got good success with inseminations, IUI. That's where you inject sperm directly into the womb. If you have really, really low sperm numbers, even just 1 or 2 live sperm on the sperm test, we can use IVF with sperm injection, ICSI, into the cell sperm injection, where you simply inject a single sperm directly into the egg in the lab to get fertilization. We have a really excellent specialized sperm testing lab. And often, you know, when another lab can't find sperm on an ejaculate, our lab actually will find just a few that we can use for IVF because we've got very sophisticated microscopes. So the bottom line is, you know, male fertility problems don't always mean that your dream of having a baby is impossible. The key really is to get expert advice from a fertility clinic.
And before we wrap up, Doc, we have one more call this morning. Thank you very much for waiting. Please go ahead with your question.
Hi, good morning, Fazeer. Good morning, Doctor. My question is, bicycles, riding bicycles for an extended period of time, will that affect fertility?
Okay, good question. Doc?
Fabulous question. And we used to think that maybe they did because of the effect of the scrotum and the pressure. But actually, you know, there was a big study just last year in the UK and Scotland, and it said no, cyclists, particularly professional cyclists, they have no more infertility, no more sperm problems than other guys. So the bottom line to that one now seems to be no, cycling doesn't. But, you know, always take care. If you get pain when you're cycling, if you get numbness in the perineum, you know, just think about it again, look at your saddle, look at what you're doing. But no, cycling seems safe, which is the good news.
Indeed, it is for all of those cycling enthusiasts, especially the male ones in that regard. Dr. Minto-Bain, as always, thanks very much, and indeed, thanks for entertaining the questions from our callers. Thanks very much for taking the time to be with us this morning.
Thank you so much, Fazeer. I look forward to next time. Thank you.
Indeed, it's coming around towards 7:22 in Trinidad and Tobago. Fertility step by step here on Morning Edition.
This segment was brought to you by Trinidad and Tobago IVF and Fertility Center, world-class specialist capabilities and care.